This is the Get Global Young Professionals Talk Global Health podcast, envisioned and created by the Irish Global Health Network and their student outreach team. I am your host, Megan Davis, Communications and Events Intern at the Irish Global Health Network and second-year medical student at the Royal College of Surgeons in Ireland. In this series, join me and my student outreach team co-host Aidan Desjardins, a microbiology student at Trinity College, as we talk to inspiring young professionals leading the charge in their respective fields, often operating in sidelines to their career, following their passions above all. Today we are excited to speak to Rosemary James. Rosemary holds a medical degree from NUI Galway and a master's in global health from Maastricht University. She has a particular interest in migration health and has completed a number of public health internships, including with WHO Europe. Rosemary is currently working as an academic junior doctor for NHS England. Welcome to the podcast, Rosie.
Thanks, Megan and Aidan. I'm happy to be here.
We usually begin by asking guests on how they got started in their field. So, how did you get involved in global health?
Yeah, I think I've always had an interest in global health since a young age. And if I hadn't been accepted to medicine, I think I would have gone that route. And basically, since first year of medicine in Galway, there were lots of opportunities as a student. So I joined lots of committees and societies, and then was able to attend some conferences and meet some really inspiring people. And that sort of just got me into the field of global health. So, for instance, the International Federation of Medical Students has a lot of opportunities in global health. And I also joined Access to Medicines Ireland through the university's Allied for Essential Medicines group. So that's kind of how I got involved, just through student activities in my spare time. And then as we had long summer breaks in Ireland in medical school, I was able to complete some public health internships during my summer break. So I guess I've just progressed from there.
What led you to pursue a master's in global health?
Yeah, I think just meeting other people who've done global health as a master's sort of inspired me to do that. And I found out that you could intercalate a medical degree with a global health degree. So I think I was the only one in my university to do that in medicine. But I'm hoping in the future more students will be able to. So I picked the master's in Maastricht University in the Netherlands because it offered a semester abroad to actually go to a low-income country, which I found really interesting. And they also have a big focus on qualitative research and governance in global health, and they use problem-based learning. So that's kind of what made me choose it.
You mentioned you worked in the field there. How would you say your in-field experience impacted your interest in global health?
Yeah, definitely. That's what I enjoy most is being as in the field, as they say, because you can really feel that you're making an impact and you're seeing things with your own eyes rather than just reading or hearing about them. So I suppose my first experience was in Uganda. I went as an intern for Reproductive Health Uganda, which is part of Planned Parenthood. And that was an amazing experience because I got to see so many patients in different settings, in clinics, hospitals, refugee camps. And then following that, I did an internship in Switzerland in clinics for vulnerable people and prisons. So that was also sort of in the field, hands-on public health experience. And then with the master's, I picked India, which is an interesting country for global health. So there we were able to learn how to conduct hospital evaluations, like seeing what is involved in evaluating how good a health center is and what is required, and also learning how to do basic epidemiology epidemiological evaluations.
Thank you for sharing your experience. We understand that you're involved in working to integrate tropical medicine into medical school curriculum. How best do you think we can do that?
Yeah, I'm super passionate about this. So actually, it was through the Irish Global Health Network that I was able to join the Federation for Tropical Medicine and International Health for the European region, FESTME. So through IGHN, I was able to join their board, and I'm also co-chair of their working group on tropical education. And basically what we're trying to do at the moment is figure out what is the current state of tropical medicine education in European medical schools and undergraduate training and postgraduate training as well. And then find out where the gaps are and how it can be improved and expanded. Because we know that tropical diseases, well, so-called tropical diseases, are no longer just in tropical areas along the equator due to climate change and migration and increase in human mobility and travel, and the rapid spread of antimicrobial resistant organisms. We know that tropical diseases are important in Europe as well, yet many medical students are not learning about these diseases, or if they are, it's often as an optional course, or if you're lucky like me, you're able to afford to do your own electives, but the majority are not being taught in their core curriculum about many infectious diseases that will or already are important in Europe. Recently, we conducted a survey of what is being done. So we're publishing that soon, and then we're holding a discussion at an upcoming conference. And once we do those two activities, we're going to look into developing a set of core sort of minimum standards that could be taught in all medical schools across Europe, because they have existing minimum standards for other aspects of medicine, but not tropical medicine at the moment. So I think that's somewhere we could help. But we also need to think about reframing tropical medicine. It was traditionally a colonial thing to have tropical doctors, and since this time, we've been able to we're thinking about reframing it as more global health and infectious disease, rather than calling it tropical medicine, which often has a negative connotation. So we're aware of that as well.
Interesting. Do you think will be a bit of a difficulty in adopting these standards? I know differing countries have differing education programs.
Yeah, that's a great question, Aidan. So we would just aim to create a basic minimum standard, so a sort of list per se of the very minimum that would be applicable to all countries, and then each country can hopefully sort of adapt these standards to their own health systems and their own epidemiology.
Oh, thank you. We understand you're also currently working in the field of migrant health. Could you tell us a bit about your work?
Yeah, so I'm really passionate about migration health because I was able to visit some refugee camps in Uganda, and then, as I said, in Switzerland, helping out in refugee clinics. And also in every hospital I've been in, there are always refugees and asylum seekers who struggle to access healthcare. So it's really sort of impacted me that way, seeing how they suffer compared to nationals of countries. So since September last year, I've been helping out Lancet Migration to establish their European regional hub. So I'm a research fellow for Lancet Migration at the moment, and I started by mapping existing initiatives in the European region to see what gaps we could fill. And since then, we've now formed a group of experts around the region with diverse interests. And we're working with UN agencies, universities, and NGOs to basically advance the research agenda. And we're hoping to fill gaps in evidence and to provide best practice examples so that politicians can put research evidence into practice, and also so that we can advocate for better health among migrants in the European region.
What would you say are some of the gaps in the European region?
That's a good question, Megan. So the European region is actually doing better compared to some regions, obviously because we have more resources, but also a lot of research is ongoing. But there still are gaps, and a lot of them are due to political situations. So for example, in Greece, there's a lot of resistance to welcome migrants and provide equal healthcare. In many countries, even the UK where I'm at the moment, there's pushback for receiving new migrants and treating them equally. But in terms of gaps in health topics, I think we could do better in terms of mental health, provision of services for mental health, and screening for infectious disease, and just basic primary health care is also important, as people also often arrive in families. It's important to treat them holistically through just getting them a GP, things like that. So those are some of the gaps we're looking at. And one major gap at the moment is to do with climate change and migration and health. So we're holding an event in October to bring together policymakers and health experts across the region to discuss the effects of climate change on migration and how that will affect us in Europe, and what we can do to better protect people through mitigation and adaptation.
Speaking of that connection you just brought up there, how would you say migrant health integrates into the wider field of global health?
Yeah, so I mean, some people are often wondering that how does that relate? But more than 1 in 10 of the world's population are international migrants. So it's a huge proportion of the world's population. I mean, many of us are migrants ourselves. And we know that migrants often experience vulnerable situations, and they are often disadvantaged in terms of health access and health services. Because of the way health systems are designed, they're designed to cater to nationals and local populations, but also because of the long, difficult journey that migrants often experience, which affect not only their physical health, but their mental health. So I think the field of migration health is really growing, and it definitely is connected to global health, because we have to think beyond national borders when we're dealing with migration health. We have to collaborate internationally, and we have to work together to find solutions and understand the evidence.
As we near the end of the podcast, do you have any advice for people interested in global health? Any knowledge that you've gained from your experience?
I mean, I'm not sure if I'm the best person to give advice, but definitely just follow your interests and don't give up. If you are interested and passionate about something, just find people who are as well, because you're often going to make more of an impact if you're working together on something. So work with other passionate people, and really believe stand up for what you believe in. Don't let your age or any other barriers get in the way of what you're passionate about. People will listen to you if they see that passion. And of course, join the Irish Global Health Network because they have lots of opportunities.
Thank you for the glowing review there. Do you have any other organizations or resources that you would recommend?
So I'm a bit biased, but in terms of global health, Universities Allied for Essential Medicines is doing a lot of work on access to medicines. I think they're invaluable, and they taught me a lot about the complexities surrounding access to medicines, which I think is a really important part of global health that's often not well understood or not, it's a bit neglected. So join UAM, support NGOs like MSF, all the big NGOs, but also your local NGOs, because global health doesn't have to be international. You can act at local level as well. And if you're a medical student, definitely join IFMSA. And of course, Lancet Migration, follow us online.
Thank you so much for coming on the podcast, Rosemary. It was really exciting to hear about your diverse interests you have in global health. And if you'd like to learn more about the Irish Global Health Network or the Student Outreach Team, please visit globalhealth.ie, where you can sign up for our newsletters.
Many thanks for listening, and join us again for Get Global, Young Professionals Talk Global Health.